You're welcome to Media Update channel. Today we'll be discussing about one of the upper airway infection called rhinitis. This is a pictorial diagram of rhinitis and the site of infection. Upper airway infection are the most common causes of illness that affect people of all ages in various locations of the world. Some infections could be termed as acute, which means that symptoms can last for several days, and some are chronic, with symptoms that can last for a long time, and sometimes they seem to also reoccur. Patients with these conditions seldom require hospitalization for adequate care. However, as nurses, as doctors working in community settings or probably long-time care facility, you may have encountered one or two patients who have these conditions. Some of them can be severe and debilitating, as it were. Therefore, it is important for you as a nurse, student nurse, or student doctor to recognize the signs and symptoms and to provide appropriate care to these patients. Infections of the upper airway are also known as upper respiratory tract infection, URIS, upper respiratory tract infections. The common cold is the most frequently occurring example of upper respiratory tract infections. Upper respiratory tract infections occur when microorganisms such as viruses, bacteria are inhaled through the nostrils. There are many causative organisms and people are susceptible throughout life, and the most common reasons why people seek healthcare and some may be absent from school or work is upper airway respiratory tract infections. These infections affect the nasal cavity, like I've said initially, the ethmoidal air cells, the frontal, maxillary, and sphenoidal sinuses, as well as the pharynx, the larynx, and then the trachea. That's why we refer to them as upper respiratory tract infection, because they operate or they seem to affect the upper organs of the respiration rather. And about 90% of upper respiratory disorders stem from a viral infection of the upper respiratory passages and subsequent mucous membrane inflammation. So what is rhinitis actually? Rhinitis is a group of disorders or infection characterized by inflammation and irritation of the mucous membrane of the nose. These conditions can have a significant impact on the quality of life and then contribute to sinus, ear, and sleep problems and learning disorders. And you agree with me that if you have had common cold, severe common cold, you know what I'm talking about. You feel very, very weak, feel tired, it's something that you cannot really explain. Your face is puffy, your nasal cavity is congested. Sometimes you might lose your sleep while trying to get some sleep. So it's very, very debilitating if you have experienced it. So the same way patients will experience it and they must be taken care of. Rhinitis often coexists with other respiratory disorders such as asthma in some people, according to some literatures. Rhinitis is important for you to also know and be aware that rhinitis may be grouped as acute or chronic, like we have earlier said. It can also be non-allergic or allergic, as you have seen. we say allergic rhinitis, that means it's from allergen. So that's just which let me just chip it here. We'll discuss allergic rhinitis in detail in subsequent series. Yeah, because you just need to know that it's an interesting topic that you don't want to miss. Yes. Allergic rhinitis is further classified as seasonal or perennial rhinitis and is commonly associated with exposure to airborne particles, allergens, which it may be dust, dander, fur from animals, like maybe your cat, you know, even at home, maybe your rug, dust from your rug, can make you to have allergic rhinitis. It might be from plant pollens, yes, in people who are allergic to these substances. They can be very, very severe. Seasonal rhinitis occurs during pollen season, and perennial rhinitis occurs throughout the year. So allergic rhinitis will be discussed in detail, like I've said, in our subsequent series in detail. So just keep watching this channel. So how do this rhinitis occur, and what organs do they affect, and what are the clinical manifestations of rhinitis? Basically, the exact cause of non-allergic rhinitis is unknown. Yeah, according to literatures. And in rhinitis generally, the mucous membrane linings of the nasal cavity or your nasal passage from your nostril, from your nose upward, become inflamed, congested, and edematous. They become inflamed due to inflammation that have set in. Congested, they have a lot of collections. Edematous become swollen to the extent that sometimes they find it very difficult to breathe. That's what we're talking about. There are several possible causes of this, several theories of all the inflammation, the congestions, and the edematous. But one thing is certain here, that the nerve endings in the nose are being hyper-responsive. So that is basically what happens. Once they are hyper-responsive, as a result of the inflammation, they become congested, they become edematous. So the swollen nasal concha blocks the sinuses openings, and the mucus is discharged from your nostrils, and we refer to it as rhinorrhea. So that's why people become, manifest with mucus from their nostrils. They sneeze, they cough, so that is what happens. There's nasal discharge too, and if the nasal discharge is purulent, you should know that it's from maybe due to bacterial rhinitis. So don't forget that. The individual may also sneeze, due to the irritation of the nerve endings. The individual may also have pruritus of the nose, the roof of the mouth, the throat, eyes, and ears. And in most cases, majority of the cases, you have headache due to the congestion. Yes, headache. Particularly if it's rhinosinusitis, because the sinuses are blocked. They are filled. They are collections. They are blocked. So the person tends to have headache. So how do you manage rhinitis? The management of rhinitis depends on the cause. Like I've said, it might be non-allergic, it might be allergic. So now we are treating non-allergic. So in the subsequent series, we'll be talking on allergic rhinitis. So if you're non-allergic, what can we do? How can we help patients out who have non-allergic rhinitis? So first, we have said that rhinitis depends on the cause. You must examine the patient well to identify if it's allergic or non-allergic. And how do you do that? To collect adequate history taking. It's very, very important and pivotal. History taking, your history must be complete, from the patient. Then after the history taking, you make sure you do a physical examination. Complete physical examination is necessary for that patient. As a nurse or as a doctor, you it is important for you to ask the patient about their recent symptoms as well as possible exposure to allergens. We have talked about that either in their home, in their environment, or working place. You know, and as also a nurse or a doctor, it is important for you to review hand hygiene of the patient because it's very, very important. Yeah, it's very, very important. Why do I say it's very important? You know, the patient, if he or she does not wash the hand, can transmit the infection to other people around him or her, especially at home. So that is why we need to emphasize on adequate and proper hand washing technique at all times. The person has to wash his or her hand, you know, at all times. And if the person have to cough or sneeze with the use of tissue paper, it must be disposed of appropriately. Disposed of appropriately. It's very, very important. Very, very important. So what are some of the medications we can use? We can get antihistamines. We can administer prescribed antihistamines for this patient. And sometimes we can also give them corticosteroids, nasal sprays to reduce the inflammation. Yes, to reduce the inflammation. Example of that is brompheniramine rather, brompheniramine or pseudoephedrine. Pseudoephedrine. Yeah, this is an example. This is an example of a combination of antihistamine and a decongestant medication, brompheniramine and pseudoephedrine. Yes, you can use this as for the patient. Then we can also administer prescribed oral decongestant agent for this patient. It may be patient who have nasal obstruction, severe nasal obstructions. We can give them oral decongestant agents. We can also give them saline nasal spray for people who have mild decongestant, so that the liquid the mucus can be liquefied to prevent crusting. We can also give them intranasal ipratropium, yes, Atrovent. Yes, 2 inhalations can be administered in each nostrils of the patient 2 to 3 times per day for symptomatic relief of rhinorrhea. That will also help the patient a lot. Intranasal corticosteroids may be useful for severe congestion. If the patient has severe congestion, you might have to administer prescribed intranasal corticosteroid. Yes. Then you might also have to administer prescribed ophthalmic agents like cromolyn ophthalmic solution 4%. Yes, this can be used to relieve irritation, itching, and then redness of the eyes of that patient. If the patient present with those symptoms, you might have to consider administering prescribed ophthalmic agent like cromolyn ophthalmic solution 4%. Yeah. So this is just the general information I have for you on rhinitis. Like I've said, in subsequent series we'll be discussing about allergic rhinitis, and then further discussion will be on other upper respiratory tract infections. So thank you for listening, and kindly subscribe to my YouTube channel for more lecture series. Thank you and God bless.